Well, hello everyone, and welcome to this session of the AI Nurses Network webinar series. Today we have a great speaker, Dr. Lu-Yen Anny Chen, who's a nurse based in Taiwan, and she's going to talk about her using of artificial intelligence in her research. Great, Annie. So we'll just stop sharing my slides so you can share yours, and it'd be great to hear what you're doing.
Thank you so much, Dr. Siobhán Connor. So, I would like to share my slide. So, can everyone see my slide?
Yes, they look lovely.
Okay. So, thank you for the invitation. I'm Lu-Yen Anny Chen, so everyone calls me Annie. I'm now based in National Yangming Chiao University College of Nursing, and today I'm just going to talk a little bit about artificial intelligence in nursing research, and basically is what I've done right now, or I'm doing right now. So when we talk about like AI in healthcare research or AI in general, a step-by-step process is to assess the needs of AI, whether it can make the world like much more faster or accurate, or it can save a lot of money. So you need to assess the needs, and then you're going to collect and train the data. And the next step will be integrate an infrastructure into the real world, and then it's real monitoring and evaluate. So what I'm doing is basically in the assess need and collect and train stage. So now I'm going to talk a little bit about what my research area is. So it's usually in medical resource allocation or healthcare resource allocation and in the hospital setting. So one of the research project that I'm doing now is the post-surgical patients, which I'm going to evaluate whether they need the critical care or not, because we know when patients having surgery, afterwards, they maybe would be assigned to a general surgical ward, or they may be assigned to a critical care ward. So I'm going to kind of like know how we made up this decisions, and maybe can we use the AI to make this decision faster? As we know now, we have a lot of human care resources shortage, so we need to kind of like make it more accurate. And the next study that I'm currently doing is the relationship between vital signs and complication among patients with coronary heart disease. So when we are in nursing care, the everything we do is vital signs. However, we rarely really look into vital signs. We only kind of like report it when we think is in maybe too low or too high, or we use the new score, but we never like look into the wave or how it's connected with our decision-making process. So this is also connected with how the patient had a complication. So we try to analyze whether there's a relationship or not, and also analyze that how we can predict whether they have complication or not. Another study that I'm doing that's related with AI is the wave identification among different diagnoses. I think this is something that's been a trend for a very long time. For example, we may have like ECG or CCG wave identification in a lot of different healthcare settings. So this is something we're doing as we now are analyzing a large amount of the data. So something we're doing as well. And in those study, I'm using machine learning algorithm, which is a power test automation, also the natural language process, which I'm going to talk a little bit about this one later. It's not the large language model that now is a trend, but is the language process that's connected with the health record. And also the computer visioning, which because after making this predicting model, we need to use it. So how we utilize it is usually we have produced a UI software, and then we can let the clinician to typing, or we can just use the health record that's already exist and make it into the UI platform, so we can give it a score. So the clinician can decide, oh, Do I want to also rely on this score for a little? And we know whether we need to make an accurate decision or not. And in those studies, usually I would use the health history or health record or medical record. There are lots of different terminologies, but I call it in general health history. And I would do the risk prediction. And in this risk prediction, there will be a lot of different I would say I make it into a score. So maybe from 1 to hundreds, there are a lot of different scores, and then we're going to set a cutoff points. So this is where the alerting system come from. So this alerting system will allow us to maybe adjust. Maybe we set the cutoff point score too high or too low, and then we're going into the real-time monitoring. So one of the things we use the most is called the free text healthcare data, which is the notes that nurses write every day and clinician writes every day. So it's actually a very rich data, but how we utilize it is really, really a challenge. So why is it so difficult? Because it's a manual extraction and it's unstructured test. And usually maybe different nurses or different clinicians, they have different style of writing their notes, right? Someone usually start with this patient, someone doesn't always do that. So it can be really challenging. So when trying to use those electronic health record into the machine learning, we need to know that the health record is very high dimensional and it's real world. And is there are so many rich data resources. And also the patient information can be longitudinal, which means that when we look at the structured data site, so for example, vital signs lab data and medication is very, very structured. We know at this time they probably would receive the vital, they probably have a lab result, or they are going to be administered the medication. However, it can be really unstructured data because when we talk about free text, which means maybe something happened, that's why they want to write down a note. Or the sequences can be really, really, I would say, unstructured, or it can change from time to time. So how we manage with the time series data can be really difficult because we need to try to turn it into a very predictive model, especially in machine learning. We always like one hard encoding, which means that we want a yes, no, yes, no. So this patient have a heart attack, yes or no. This patient used this paracetamol, yes or no. So we always want to have this data really structuralized and with the same time sequence. So how to make the EHR into machine learning is very different. And from my experiences, I would say that there's way, really a lot of way to make it structuralized. However, it can be different when we have different patient population or we have different goal. So the key challenges in machine learning with the electronic health record would be the data quality issue, especially number two, inconsistent formats, and also the varying terminology across different institutions. So maybe this institution called fever, this institution called pyrexia. So it can be really different and how you interpret that. Also, another one is that it's manual typing. So we can miss a word. When I want to write cardiac, I might miss a C or something. So it can be really difficult for the machine learning to learn whether it's a word that I need to use or not. And also the temporal complexity. Excuse me. So it can be really irregular and also the event interval can be vary, which is the time series that we were talking about. It can be from time to time. Maybe this patient had five notes while this patient only have one note. So how are you going to deal with that? That can be a challenge that you think about when dealing with the electronic health record. However, um, we do have like kind of a way to solve those issues in different type of patient with different population or disease. So this is something from my study, and thank you. I think you're
Oh, that's great. Thanks, Annie. It's really useful insights into your work in Taiwan. I'm just really curious how you got started doing AI research because I guess it's quite a new area for nurses, and I'd love to know how you got into it.
yes, actually, I'm going to go back to one of the slides.
Mm.
Um, this part, oh, because my doctoral study is based in clinical decision making. So while I'm talking about the prediction model and I related that to the medical resource allocation, is that I reflect to what I've been studying while I was doing PhD. I'm thinking about how like clinician or nurses make day-to-day decision making. So how do I decide whether I want to put this patient in critical care or not, or when I want to give administer medication, or if I want to do this sort of intervention, because we can always decide what care we want to input, right? It's
Mhm.
a like although it can be a bundle care, but you can always adjust a lot part of it. So I think this is where I come from. So I found that, oh, actually, machine learning can help us to do this complicated decision-making process because it's unlike some of the areas that when we put one, it will become two. So we always need to think about lots of different elements and as well as the factors. So I think that's something where I come from. And I think, yes, it can be quite difficult, but however, I found it not as difficult as I thought because it's a language.
Really?
So I thought maybe you can kind of starting to understand this language as I'm speaking Mandarin, also English.
Mm.
So when you try to understand this language, you understand a little bit of the rationale behind this language. And then you can start to think about what I can utilize in the clinical settings into this language. So that's, I think, where I come from.
Yeah, fantastic. Yeah, I definitely once you yeah start to get to grips with all the jargon that's used in AI and all the technical language, yeah, I think it does make it a bit easier, but that takes a bit of time.
It is.
Yeah, have you any advice, Amy, for nurses, yeah, who maybe want to learn more about AI, maybe how they could get started and areas of yeah, get working with machine learning?
Yeah, I think actually I would suggest everyone to start with something with AI or not only just research wise maybe from your daily routine. Um, because I think it's actually a trend in the future that the technology is advanced so fast like nowadays. Um, Even in AI, maybe one model just exists and next day, boom, something came and right across. So I think while starting to use some of the AI technology, you might get to know what AI can help you to achieve. And I think one of the thing in nursing care is that they can't really override the nursing care, but they can help to make the nursing care routine faster and more accurate. So, as what I've just mentioned, the manual notes, we always probably made a mistake. But when you're using your phone, you will find that, oh, it helps you to say, oh, do you want to say this word? Did you, is this a typo? Right? You can always choose. So I think this kind of thing is helping us to get our care more, I would say, person-centered.
Yeah,
So
great.
I think it's a part that maybe the nurses now can try, and I think ChatGPT is a great thing you can start with because it's much more easier to have the first input, and you can always think of something that you want to train your ChatGPT with, and then you
Yes.
can, yeah, and you can probably start it some small projects.
Yeah, I
Yeah.
actually know a nursing colleague who's using ChatGPT to teach herself about AI. So she keeps asking the chatbot about different aspects of machine learning and things she doesn't understand, and I think it is helping her. So thought that was a great use
Yeah,
of
I
ChatGPT.
personally did this as well. I'm doing that
Mm.
every day as well.
I know it's not 100% accurate and it does kind of churn out rubbish every now and again, but I think, yeah, it's quick and easy to use. And yeah, I think getting nurses into using AI tools, they'll start to see, the advantages and disadvantages with them over time. Great. So my last question then is, I know it's a really difficult question to ask, but where do you think AI will go in the future? Because it is moving on at such a fast pace and there's new AI tools coming out all the time. Do you have a sense of where we might go with AI?
Yeah, I think AI would definitely be utilized to I think the one of the big things that I feel is a trend is the big data. So now we have a lot of data. However,
Mhm.
like in the I would say more traditional research, we use the statistic or we try um to find the pattern or find a model to see what we can prevent or what's a better treatment. But I think with those big data, we now would have a lot more involvement with the utilization of those data. So how to utilize those data into intervention or involvement with the treatment or research, I think would definitely be a trend in the future, and especially how to make the care individual, to have like person-centered care for each of the patients, as each patients have their own significant history. I think that's probably a trend in the future even for
Yeah.
medication as well. Yeah.
Great. Yeah, yeah, I agree. I think AI can definitely help us personalize our care a lot better if we've got
Mhm.
good data to base it on. Um,
Yes.
so yeah, getting the data quality right in the electronic health record is still a work in progress. And AI can help us with that too. So hopefully it'll be a really supportive tool for nurses going forward. Yeah. Brilliant. Well, thanks so much for your time today, Amy. Your presentation was great. It'll be really helpful to other nurses wanting to learn a little bit more about AI and hope to catch up with you soon in person.
Thank you, Siobhán.